Okay, I think we're going to make a start. Welcome, everybody. It's lovely to see some of you joining us. Today, we are hosting a very quick, short and sharp pop-up lunch and learn about anchor frameworks. A little bit about the format of the session. So we're using Zoom webinar, which is slightly different to the Zoom meeting format. That means that you can't see each other, but don't worry, you'll be able to see the panelists, and the panelists will be able to see questions that you ask via the Q&A button, and also see the content that's coming out through the chat. So we know that there's some people joining today who might well have experience of developing similar frameworks, missions, or charters, and we'd love to hear from you and hear your kind of reflections, additions, questions, challenges that you face, particularly if you're doing something similar. And the way we're going to run this is, in a moment, I'm going to hand over to the first of our speakers. We've got two sets of speakers, each speaking for about 10 minutes about their experience of developing a framework. And we're then going to open up to Q&A. And don't hold back. If there's a question coming up for you as you're hearing people speak, please do chip in, add it into the Q&A button and or into the chat. That would be great, and we can get started on those. That'll be the bulk of the session from about 25 past onwards. So that's kind of set the scene. I'm gonna hand straight over to Nicky and Les, who are our first speakers, who've been involved in doing some really wonderful work up in Leeds and the surrounding area. So Les, I think you're kicking us off. I'll hand over to you.
Great. Well, thanks for that introduction and good morning to everybody. Great to have this opportunity to talk to a health audience and a wider one too. So for those of you who've watched the video, our framework's a little bit different. It's about a network of anchor organisations working in Leeds and Leeds City region, which I'll talk about later. And it's a tool for how those organisations can make practical change, really. So it's not so much a charter, but it does certainly link to those. So we'll talk through the gestation, and Nicky will talk about the framework itself and how we've used it, and then we'll end with a couple of examples. And I should probably introduce myself, which I've failed to do. Just I'm a freelance consultant. I've worked previously in regional economic development and sustainability think tanks. I'm working around agendas like inclusive growth, economic strategy, and research. And then the key element here is around the Leeds Anchors programme and this framework. So onto the framework itself, then we started developing this back in 2017-18 when we were commissioned by Joseph Rowntree Foundation, JRF, to do some work on a Leeds City region anchor institutions programme, get it set up and help to oil the wheels of running it. As part of that, then early on, we started meeting with the big anchor organisations in the area. So this was West Yorkshire, about 2.5 million people. There's 5 big local authorities, including Leeds and Bradford. And we tended to talk to senior people, often chief exec level in the local authorities, FE colleges, one large hospital and a university. There are a number of observations that came from those meetings. First was actually there was real enthusiasm for the ideas behind anchor organisations and thinking. But with that came a bit of a challenge of how do we make this real? The need to demystify it and turn from the jargon of inclusive growth and anchors into what do we actually do day to day. The other thing that came from those meetings was actually the same themes reoccurred across different types of organisations in different places. And Gwenna, if you could just flag up the slide now on the different themes. There were 5 key themes that emerged across organisations. So everybody would have big employers, so they could recruit people, they could give better terms and conditions to current workforce and so forth. They all bought a lot of goods and services as a procurer. They all delivered really key services in one way or another, different ones according to the type of organisation. But you could think about how all of those reach disadvantaged communities. They all had quite big physical assets and environmental impacts. And again, they all had the potential to collaborate with others. So that's the slide done. And I just say then, based on that, we decided to work up a framework that said for each of those areas, basically what can anchor organisations do that we could use in a self-assessment way with a bit of facilitation to help out. We completed the first draft of the framework in early 2018. JRF kindly designed it up for us. And since then, the City Region programme merged into a more intensive one in the City of Leeds with 12 anchor organisations, including 3 healthcare bodies. And we updated the framework just November, December last year. So Nicky and I did that. and JRF have again kindly designed it up for us. So over to Nicky on the framework itself and a little bit about how it's been used.
Thanks, Les. Yeah, so basically the framework is a tool for anchors to be able to use to say, where are we now? Where do we want to be? And what are the practical steps that we can take to help us make that journey? It's designed really to be used in two ways. Firstly, at a high level, very sort of senior and decision maker level. So it gives a kind of a very high level view of what it means to be an anchor institution. So you can see that very clearly. But then it also breaks it down into quite significant detail so that specialist practitioners can actually go through the nitty gritty and work out what it is that their organizations are doing and where they can go further. So it takes each of those dimensions that Les just described to you in turn and breaks them down into what we think are the sort of constituent themes that go with that. So if we think about the employment dimension, for example, there are a number of elements that sit within that. So within employment, you might be looking at your recruitment, your pay and conditions, training and development opportunities, and your kind of healthy workplace practices. Gwenno, if you could pop the slide up for me, please. Thank you. So this slide just basically pulls out one of the pages of the framework and shows you that on the left-hand side, we've got kind of ways that you can think about your recruitment, and then it breaks it down into a number of further steps as you go along, and then it gives you an opportunity to score from 1 to 4 whether or not you think you're sort of doing minimal action, i.e. just meeting your basic legal requirements, up to level 4, which might be somewhere in the realms of best practice, and that would be hopefully where we would want people to aim to be, but don't expect necessarily that everybody would have to be at that point. And it's then up to organisations really to use it as a self-assessment tool and help them to see where they can get to. Thank you, Gwenno. That's it with the slide. So as Les said, we know that the progression framework is being used by quite a number of organisations in and beyond the Leeds City region. Most notably, it's being used by at least once, and in some cases twice, by all of the 12 anchor organisations within the Leeds City anchor network. And what's really positive and encouraging about that is that it's had sort of senior ownership at the highest levels within those organisations, so that it's really been owned and committed to. The practical process really for going through the framework is, first of all, to sort of make the commitment to using it, and then to hold what we sort of describe as a surgery style session, where you maybe spend half a day or so with the senior specialist lead from each of the dimensions, working through the relevant chapter and having a fairly open and frank discussion about where they think they are and where they might want to get to in the future. Usually that would involve, for example, on the employment side, it would be the director or the head of HR, the finance director looking at procurement and often having responsibility for the estates side as well. And then usually somebody who has a fairly central corporate role that kind of holds the reins on the entire process and kind of is the sort of person that facilitates it and makes it happen internally. Les and I have, in all of those cases, have facilitated that discussion. So we sort of sit there as a neutral party, and the benefit of that really is that it helps to moderate some of the scoring that people give. It sometimes provides a bit of a challenge function if people are kind of maybe underscoring themselves, but in our view they might be kind of underplaying themselves. And it also tries to help tease out where the action can help people to move on. So if somebody is scoring themselves a 2 but would like to get to a 4 on a particular area, we can kind of challenge a little bit to make sure that there is a view about how they could actually make that change. We pull all of that together then and provide a sort of a summary view of it that can then be discussed at a senior leadership team. And we think that's the kind of the important bit really, because that's the stamp on it really that gives it the commitment for the actions to move forward. I think there's probably quite a few important principles to note about the progression framework, because it is very much a self-assessment. It's not an audit. It's not a kind of sort of people coming in and externally pointing a finger and saying, you know, you're not doing well enough or you must do better. It's really just a way to prompt discussion internally, and to encourage people to think about where they are. And it's not about casting judgment or creating lots more work for people to do. And in that sense, the numbers really are kind of not that important at the end of the day. It's more about stimulating the discussion, and the numbers are just there to provide a benchmark and some form of measuring progress that you might be able to do if you were then, as we encourage, to go on and review that, your baseline a year down the line. The other thing to say is that, as I alluded to earlier, it's not really important to score a 4 on anything. Sometimes the journey is more important, and actually scoring a 4 can sometimes well, not be appropriate. And the other thing is to not try and do everything at once. So really this works best if the priorities that fall out of it go with the grain of what an organisation is wanting to achieve anyway, and is rather than sort of trying to force an issue, say actually this element isn't for us, and to move on. So I think that gives a bit of a view of how it's being applied. Les is going to give a bit of an example about where we know change has occurred on the back of the framework being used.
Okay, so just 2 quick examples really. The first one's in Leeds Teaching Hospital Trust, so one of the biggest hospitals in England, in Leeds city centre, and slap bang in one of the 1% most deprived areas of England. So the trust also, as many hospital bodies, has lots of vacancies, and through the progression framework and their own internal thinking, they got through a position where one of the actions when they reviewed the employment part was, we want to do more to try and recruit people from the local area. So following on from that, they set up a really good work programme and outreach employment initiative with the City Council and some community groups. It reached out to around about 200 or more people who've attended events in the local deprived areas around the hospital. It set a really inviting tone for get involved. We'll make this really straightforward. We'll talk at your level. We'll talk about the types of opportunities there are. Out of that, then, of the people who attended, nearly everybody's had a positive outcome of one sort or other. If it's not been on an employment programme itself, then people have gone on to English language courses, for example. But there's been about, I think from the first 2 sessions, 60 people went on to a 6-week employability programme, and about 30 were in jobs in the hospital following on from that. So some really good examples. The second example I'd note is in Leeds City Council. They did their progression framework review back in 2018. Again, it was the same sort of mix of people that Nicky mentioned, this time in separate interviews. So it was the leads in procurement, HR, policy people, going through their own sections of the framework. One of the examples that came out was on procurement, and the City Council had done some really good stuff on procurement to, for example, employ local people as part of big constructions and developments in the city. But they'd maybe not done as much as they could on social value or on contracts that weren't about development. And going through the progression framework, they scored a 2 out of 4 on one and a 1 out of 4 on another, and they were a bit disappointed with that. But what it did do was actually spark the drive to create a new procurement strategy, which came into effect in 2019. And as a result, then there's new work and policies in the council to always invite at least 2 local companies to bid for work for smaller contracts below about £50,000, to break things into small lots to make that more possible. And on social value, then for all contracts above 50,000, they now weight that as 10% of the marks they award when they decide who to contract with. They also talk about living wage policies, and although they can't legally enforce that as through procurement, they do ask people to report on what they're doing on living wage, which hopefully nudges them somewhat. So a couple of really good examples. You can't say definitively whether either of them would have occurred anyway or in a different form without the review, but it did seem to add priority and prompt to them and provided a tool to sort of track progress. So that's the examples. Just a couple of learning points from myself and Nicky, just to cap off and finish off. I mean, the first thing I'd say in contrast to some of the charters is that the tool is really for organisations who are already motivated to do something. It's not something you give to an anchor and say, here you are, go away. You know, be an anchor, do more on inclusion. But if an organisation wants to do something but isn't really quite sure what to do, hopefully it's a really helpful guide that gets down into really quite a lot of detail about what those steps might be. Nick, have you got one?
I think the one thing that I would say to start off with was that actually these things take time, and it's not a question of trying to sort of achieve everything at once, but realizing that you know, sometimes taking a smaller handful of things and doing them well actually gets you further down the line, and that there's usually a time lag, therefore, between sort of making the decision to do something within this progression framework review and it actually happening, and it does need somebody to take the reins on that and to move it forward.
Thank you, Les and Nicky. That was a really, really, really helpful overview of the work. And yeah, I mean, there's so much in there, but in particular, I liked what you said at the end there about it's about the tangibility of some of these actions and making it really clear to organizations what the kind of journey from good to better to best looks like. And as you say, it doesn't always have to be disheartening if you're a 1 or a 2. Those are really important starting points, and they can often be a big spur to action as well. Thank you for sharing those. We're going to come back to you with questions in a bit, and I can see a couple have come through the chat and the Q&A, but I really want to encourage anybody who is thinking questions or thoughts or reflections while they're listening to you to add those in. And next up, I'm going to come to Andrew, who's going to share a little bit of the work that he's been doing at Barts, which actually builds on this framework from Leeds. Andrew, over to you.
Yeah, thank you, Julian. It's great to hear the progress at Leeds, because the JLF framework was one of the things that we have taken a lot of inspiration from, as well as the more recent work from the Health Foundation. I'm Andrew Attfield. I'm the Associate Director of Public Health at Barts Health NHS Trust, which is a large group of hospitals in East London. And although I've been in the NHS a good long time now, prior to that, I worked in economic and community development, local authorities and for the third sector. So, you know, this is very much up my street, as it were. I've got a couple of slides. The first one up, Gwenno, just to give you a context. For those of you who know our part of the world, this is East London, and these are tube and Doctors' Light Railway stations with the expected mortality rates across you know, expected age of there's significant health inequalities across the patch. It's slightly out of date now. I think probably some of the tubes have even changed, but it gives you a sense of the real difference between extremely rich areas, extremely wealthy areas around Canary Wharf and the City of London, and some of the poor areas in what is basically the old East End and the wider East London area. And this covers around about 2 million people, so it's a big population. And in terms of our work, which has started maybe 8 or so years ago on this, we were very much driven by the sense of needing to use every tool at our disposal to reduce health inequalities. In terms of if I got the next slide, Gwenno, this is the framework we've used. Now, you know, a lot of the work we were doing in some of these areas was quite well advanced. We have quite a big community employment program. And the way it works with us is effectively we've tried to mainstream local employment by having a talent pool approach, where we feed local residents into a talent pool who then have effectively treated as internal candidates for 2 weeks, entry-level job. So it's about you know, and that has that means that they have a good first bite of the cherry, as it were, in terms of employment before going out to the wider market. And we also had quite a big careers program now, which is funded through charitable sources, which is engaging with about 37 schools. So this is the framework we've used, and we've used 3 themes around that. One we've described as inclusive economy, and I say we've pinched quite a lot of the JLF type of thinking on this. And as you can see, the 2 themes there around employment and careers and procurement. The one at the bottom is around better environment, talking about particularly some of sustainable development and capital investment. Sustainable development is another area we've done a lot of work on, like everyone else really, in terms of carbon reduction, improving air quality, reducing the amount of waste going off of our hospitals and so on. And the capital investment I'll talk a little bit more about later on is about introducing sustainability and both on socioeconomic and environmental measures to do that. Now, the middle one I wanted to say a little bit about, because we talk about improved health. And coming from an NHS point of view, I think this is actually the trickiest one to kind of pin down, both in terms of what it means and also how you measure improvements in it. But I think this is the way to kind of anchor it into the whole integrated health and care system type of thinking that's going on. The two sorts of areas there, the service model is basically how we provide services in a community friendly and effective way, obviously working across primary care, social care and mental health, as well as in the acute side. And the second one I've described as civic health, which is pinched again from other sorts of thinking, which is about how as staff and as an organisation we engage properly with our communities. And I'll give an example of that in a minute. And I was very interested to see Julia's film, your film, Julia, about some of the examples from the States, because I think that's what I've described as civic health has really been pioneered in Chicago and elsewhere. So that's our broad framework. And to give you just one last slide, Gwenno, I quite like this. I'm a big fan of the picture speaks 1,000 words. These are 4 pictures, and this is about the pictures there with the fake blood and the 2 young people working on a false arm there from a violence reduction workshop we did with young people last year, was it 2019 now, which was called a Zero Responders Workshop. We have a group of colleagues from nursing backgrounds who go out to schools and colleges, preaching the word on violence reduction. They go into young offenders institutions and pupil referral units. These young people are from different backgrounds. They're from potential medical students, and we called it a Zero Responders Workshop, which is basically what happens, like a first aid. What do you do if you're first on the scene in the incident of a violent crime? So that's some of the pictures from there. And the other 2 pictures are from a simulation centre from another, probably a different group of students, I think. And in the middle there, in the blue dress on the top left, is our chief executive, which gives you the sense of you need some good leadership involvement there. And the one I'm just quite fond of the people jumping up and down there is again from the careers program with some of our clinical colleagues enjoying themselves working with the young people. So that's the end of the slides. I wanted just to say a couple more things in terms of where we are at the moment. We're quite taken up with the integrated care system at the moment, and I think I do feel we've really this agenda has taken off a bit. I think it's been highly the response to COVID-19 has clearly helped drive this a lot. I think it's acted like an X-ray on our society really, and it's really exposed the inequalities at social and economic level as well as health level. We all know those are the health and wealth connection is critical. So we have devised a draft charter, an anchor charter across North East London. So our hospital group includes 5 hospitals, but there's 2 other big hospitals in the area, plus obviously local, I think 7 local authorities, the City of London, and a number of universities. So we have a draft charter on that, and I think that's given us a lot. First, next step is how do we then think about measures and improvements, and we have 4 work groups that are working under this. I have to say at the moment they're a bit paused at the moment because we're frankly up to our, we're up to our neck in the second wave, third wave, whatever wave we're up to COVID. But there is an employment and careers group with some good work in, I think, across both health and care careers. So linking with the local authorities, skills for care, and obviously the independent sector there around procurement. And our procurement colleagues are working up, a joint portal for opportunities, and similarly are sharing best ways in which they measure social value. Then there's sustainability and an estates group as well. So I feel it's making good progress. As I said, it's I have to say at the moment it's like you should expect really. It's a bit of a struggle, but I'm sure I think the momentum will continue. Then the last thing I wanted to say on the social value side is I'm very conscious of local authorities are a lot more on social value than the NHS. So we have a great deal to learn on this, and I think this is a particular focus for us is that with one of our hospitals is an ancient Edwardian hospital, built well over 100 years ago now, in Leytonstone, Whipps Cross University Hospital, which is desperately in need of refurbishment and rebuilding. So we have a big capital program for that. It's one of the first hospitals that's actually gone for a business case. So we're trying to trial that out in terms of social value. And I'm very interested to see if we can use the measures around social value, ideally in a way that parallels the anchor type networks as well. And I'm interested. It's actually a good reminder looking at the 4 phases that Leeds have done. So I think I'll stop there, but obviously happy to take questions.
Thank you, Andrew. Brilliant. And yeah, lots in what you've said there. And I think one thing I'll pick up on in particular before we get out to Q&A is, when you shared the framework that you've been using at Barts, one of the things you said that I think is true of many organisations is that much of your work on sustainability and employment has, predated the anchor terminology, but the kind of anchor framework has perhaps become a kind of unifying framework to bring some of this together on. And it's really, I think that's the case for a lot of organizations that might have done work on social value and employment and sustainability and other areas. And this, I think this kind of framework, this conversation we're having today is about how you bring together those different pieces and start to have a slightly more kind of common language and common set of perhaps aspirations and goals around those too. Les and Nicky, I want to invite you to turn your cameras on and come in off mute. We've got a few people asking questions. Some really lovely questions have come in actually. And do please others keep adding to this. The first one I'm going to share is around, it's a great question. I think it's one that we grapple with a lot, is when you're developing frameworks like the ones that you've all developed, did you set any kind of goals or outcomes at the start? So where you've got particular indicators of success, have organizations that you've worked with, or, for example, the Leeds network or Barts in your case, Andrew, set a target such as X number of organizations moving to paying a living wage. So yeah. I'd be really interested to hear about your reflections and thoughts on that, because it's something that comes up a lot, whether or not we should do it. And if so, how do we set it, without it just being a kind of pie in the sky thing. So yeah, who wants to kick us off with that?
Have a go. I mean, it's a really important point, and it has come up particularly in the Leeds Anchors Network. So it's 12 organisations. It's chaired by Peter Slee, the Vice Chancellor of Leeds Beckett University. He's really interested in the metrics of this. We've wrestled with it for a while, so there are different ways of looking at it. At one level, we've always tracked sort of activity, so how many conversations are going on, how many organisations are engaged, and so on, which is great at doing stuff, but we don't know about the difference it makes. We've more recently set up a list of outcome indicators that all of our anchor institutions are now committed to measure. So they're things like employment levels, the sort of the makeup of that employment in diversity terms, apprenticeships, living wage, for example, percentage procurement in Leeds and West Yorkshire, and a few other measures. So there are a set of core measures. I mean, carbon emissions now as well. We've upped the environmental side within this. So each anchor will report on that in a year. We've not gone so far as setting targets. We have done, but particularly with COVID, I think there's quite a hostage to fortune element in areas like employment. If you look at the numbers employed, which are likely to go down with the best will in the world over the next 5 years, probably. So we're looking more at individual organisations setting their own targets rather than a network-wide one. So, I mean, Beckett University have set targets for procurement, for example, about the proportion that's local. So there's quite a lot of activity, but it is quite difficult, and there are some complexities involved in working out how much difference is due to the anchors' work and how much might have just happened anyway or be due to other factors.
So interestingly, organisations perhaps going down the route of setting individual targets rather than agreeing that collectively as a whole. Okay, great. Nicky, did you want to add in anything to that?
No, I think it's just one of the differences with it is because for some organisations can't take on all of the types of priorities, so it's difficult to set targets around that without people feeling like because they're not doing something, they're therefore failing or not doing it properly. So some organisations, for example, just aren't able to take on some of the procurement aspects, and health is a good example of that. Some of the organisations, they just don't have the levers. So they might choose to focus more heavily on the employment side. And so you've got to find the right balance in the kind of target metric framework that recognises that as well.
Yeah, that's a great point. Actually, I've seen some local networks where they have partners that have huge capital investment projects going on, but barely any workforce. So some of the employment stuff might not be directly relevant, but of course the capital investment project becomes a massive lever to use. So not all of the indicators are always universally applicable, are they? Good point. Andrew, did you want to share?
Yeah, no, it's a really interesting area. In some ways, I think I see it as a two-phase process. It's like an engagement stage where you don't want to frighten people off, as it were. You want to get their interest, and you want to get them as working with partners. And then the second phase, I think, is the accountability aspects. Having said that, I think there's a theme within procurement where accountability is right there from the beginning. In other words, if you've got a big contractor who's we're hoping to get, say, Whips Cross, we will hold them to particular targets, and we will include within those sub targets relating to ethnicity, sex, and other protected characteristics. So I think in terms of dealing with that, I think there is a broader question. It's much bigger than the question today, but how you deal with multifactorial things around social determinants of health. We all know, we have half our population is working population is now either on furlough or getting unemployment benefits of one sort or another. I'd imagine the same is true across the country, really. And I know London is London, but it's seen as it's been massively hit by COVID. Some ways worse than other regions. So it's a very how the market works, as it were, in these things is actually quite hard to measure. There's things that you can't control, as it were. And we count the number. We worked out about 40% of our residents, of 18,000 staff roughly now. About 40% actually work in our core boroughs, and about 65-70% work in the broader East London area. Now, is it sensible to set up, make that 80%? I don't know really. That needs a bit more debate.
And I know in the States, some of the research I've done out there, the two main things they have set targets or outcomes around have been spend with local businesses and jobs created, local jobs created, or number of people employed who come from kind of local talent pipeline. So it's not necessarily that you want to set targets or that targets lend themselves to everything anyway, is it? I suppose there's some obvious things which are a bit easier to set outcomes around. There's some other questions coming through which are really helpful, so I'm going to move us on a little bit. There's an interesting one around sustainability. So it's a question from someone working at the Royal Free that's used the Leeds framework again. Great to see it's been used in so many different places. But they've said one area it didn't specifically look at was around sustainability. So how have you seen the anchors that you've worked with, and Andrew, in your case, how has Barts, I know you've done lots on this, specifically addressed the areas of sustainability in relation to being an anchor? Do you want to share any thoughts you've got on that?
Yeah, I mean, that's a really topical question for us, because I think when we developed the framework, we were quite conscious, actually. It was light touch on environmental issues. There was bits in there, but the driver from the sponsors at the time was more get the social inclusion side right. I think as time's moved on, it's been really evident that clearly climate emergency is a real pressing issue. Anchors themselves are doing lots of work on sustainable development, and we need to address that. So the update of the framework we did in November, December has actually changed what was described as bricks and mortar into a section called environment and assets, as we've presented it today. And all the questions in that are about environments. There's questions on climate, waste, energy, biodiversity, and so forth. And we're just looking really at the network about how we take that forward now, and particularly how the anchors network in Leeds interacts with the Leeds Climate Change Commission, and how we sort of get that join up to work and make a difference. So yeah, really good question to ask.
Brilliant, thank you. Nicky,
Yeah, I mean, I
Andrew,
can
come on in there.
same waving a hi to Miho across the virtual space, across the top to North London. We know. I think in some ways it's a different step because there's quite a strict sort of regulatory sort of framework around sustainability. In a way, it's a bit of a no-brainer, really. If you use less energy, less water, etc., it's you're going to save money. It's a slightly different kind of framework. And we have a green plan now, which is excellent. I think it's got a lot of good serious markers on that, and I'll be surprised if most public bodies now will have those sorts of plans. So it's against the question of not overlapping really and not duplicating, but using those. One area that I think is interesting is air quality, because all local authorities, hospitals, universities, etc., all have vehicle fleets of various sorts and things like that. They all have big buildings. So I think that's increasingly will become something that we need to focus on as an anchor outcome is improved better air quality around our neighbourhoods. We've done some work on that. We've got a clean air framework plan, which is a global action plan. It's got about 150 different measures. We're trying to fight that down to something a bit more practical.
And one thing I think that sometimes the frameworks that we use, not just the Leeds one, but others that I've seen both in North America and in the UK, is that the frameworks kind of lend themselves to looking at different disciplines or functions and breaking down what people within a function such as finance or procurement might do. But some of these areas like sustainability do flow across all of them. And, there's some really wonderful work being done by procurement teams around setting high expectations about sustainability through some of their contracting and procurement processes. And I wonder sometimes there's a kind of like, how do we reflect that interdependency within frameworks that naturally lend themselves perhaps more to particular departments or functions, filling them out? And maybe that's something we can come on to. But I wanted to just move us on because there's a few other questions. We've got about 10-15 minutes left and there's some great ones coming in. There's one that's got a lot of likes that I'm going to come to. We are going to get through them all, but this one looks really popular. And it is around whether or not anyone has seen or been involved in developing frameworks and or setting outcomes by co-producing with the community. So have any of the frameworks you've been involved in developing involved working closely with the community to set some of those outcomes? Who wants to kick us off? Andrew, do you want to kick us off with any insights from Bart's first? Then I'll come to Les and Nicky.
That's a really good question, and I think a difficult one as well, because there is a danger whenever you work from institutional type basis, is that it's top down type stuff. The rest of it, in fact, we've got a huge debate, not debate, but a huge thinking around how we engage better with our communities. And again, a lot of this is COVID driven in terms of now vaccine driven as well, in terms of how we get the message out. We have like Leeds, a very diverse population. It's a hugely diverse. So there's a lot of thinking on this, and as I say, I think it's something I don't think we've done particularly well at the moment, if I'm honest with you. But it's something I think we would like to be better at. It's having a long time ago now, admittedly, but having run a sort of community development trust, it's not something you can just pick up the community as a big lump and then say hope for the best. You've got to look at you've got to segment it into different communities, and both by place and by other factors. And you've also got to come up with ways that are really positive, as opposed to the sort of public meeting type approach, which can be a bit, just get the usual suspect type of thing. So I think that's a big program of work, and the NHS, frankly, is not that, certainly from the acute side, not that great at it. So I think I'm very happy to learn from partners. Where I think it has been good though is that we have been working with local authorities and their networks and things like that. And I think that's probably the most encouraging, useful line of inquiry really, is to work with the whole voluntary sector networks, rather than trying to invent the new ones.
Yeah, I mean, I'm going to come to you, Les and Nicky, in a moment. I was just reflecting. I think I've come across two cities that have done that well, where the community was really embedded in helping develop their anchor strategy and the outcomes that were central to that. And that was Toronto and Los Angeles. And in both those cases, it was a university that was leading more of the community engagement and more of the community involvement work, and it had arisen out of some of their historic relationships with the community, and was primarily the discussion was about how the community used their spaces and their buildings and their assets. So it kind of came in through a different way. Les, Nicky, anything you want to add to this point before we move on?
Yeah, I mean, I wouldn't say that the framework was developed with a community engagement piece in mind, but it has kind of tipped itself in that direction in its application. So we've got an element within it that's kind of called service delivery, which basically means no matter what sort of organisation you are, how can you think more carefully about the services that you're delivering in that place? And the way that the network's tried to do that is thinking about focusing on the priority neighbourhoods in Leeds. So these are the most disadvantaged neighbourhoods in the city, and thinking about how they can therefore target their services in a more coordinated way in those places, and doing that in partnership with the places who are telling them what their own priorities are, if that makes sense. So there's a dialogue happening between, for example, New Wortley in the city, and the needs and challenges that they're facing, and what each of the anchors can bring to the table. So, for example, Leeds Beckett University is helping deliver law clinics locally, so that people that are needing law advice can go to the community centre. They get advice from students who are going through their law degrees, and they get that free. So everybody wins. You know, the community people win, and the students are getting valuable experience for their own degree qualifications as well. So there's been quite a lot of work to look at where in the city those overlaps happen and where communities can benefit.
Brilliant. Thanks, Nicky. Les, anything you want to add on to that?
No, I think Nicky said it all really eloquently, so I won't encumber it further.
Yeah, I think if I just dive in a little bit on that, I think the students at the universities are also incredibly great. I mean, I was talking to our medical school, dean of our medical school this morning, and he told me about the teddy bear thing they do with students, dental students who go and talk to about dental health to primary school kids. I must admit, I haven't come across that. So that's a small but exciting kind of initiative, isn't it? That, to my mind, is a kind of anchor approach. You know, it's about using that expertise about something that's found, you know, we all desperately need, improved oral health.
I want to bring us on to procurement now, which almost always comes up because it is one of the biggest levers that anchors have, and it's quite a tricky one. And Helen has asked a great question, which is, you know, approaching a conversation with the Director of Finance about procurement, which might be one of the kind of lesser developed area in the framework, but anticipating, rightly so, I think, a question around affordability. You know, what's the trade-off? What does this cost? And I wondered whether those were questions you'd come across, Les, Nicky, Andrew, and how you'd kind of responded to them if and when they have come up.
Those questions certainly do come up, and increasingly so with tight public finances. There's not a black and white answer. We've sort of looked around other examples where you adopt this approach and you can demonstrate savings instead of costs. So you can't really get figures very easily, at least we haven't. What does come up actually is there are lots of ways of put this about why doing a quality-based approach might give you benefits that outweigh any minor additional costs. So particularly, you know, where there's been examples over the last couple of years of large service delivery companies going bust and leaving local authorities in the lurch. So actually pushing on local resilience rather than dependence on, you know, often international supply chains or large multinationals really is a good one, and particularly in a COVID recovery framework position, really important too, because people say actually if there's procurement for local businesses in more deprived areas, it could help keep those afloat where they're really needed at the moment. So some of those buttons are really important about helping local businesses flourish, and then the indirect benefits. What's difficult is then putting a price on that for an individual organisation if the benefits are elsewhere. But there are other benefits too, and quite often actually say this is about giving nudges. So even if you don't necessarily say we'll put 20% of our scoring on social value regardless of the price, you can just put things about saying these are our social value commitments, we expect partners to do it, we'll track what you're doing. So there are ways, even without being so explicit, where you can edge towards those things.
Absolutely, I like that phrase, nudges. It's absolutely about that, isn't it? Andrew, did you want to come in? I think you
I think there's two bits to this. So the first bit is opening the door to local businesses, particularly small businesses. That's about procurement mechanisms and measurement and things. And I think the much harder bit, maybe 80% of the challenge, is around the capacity of those businesses to respond. And I'll give an example. For example, is one of our local partners did a very good exercise in terms of working out what what percentage of their contracts were taken up by small businesses, and wanted to put a local London wage requirement on it. And not surprisingly in a way, but found out that a lot of their local businesses weren't paying London living wage. So there's a bit of a. I'm sure that's a common, a predictable but common problem. And of course, in social care, it's a hot issue. So I think there's a bit of a sort of capacity of the local business, and I think again there's some really good examples from the States on some of this in terms of encouraging businesses to form cooperatives and collaboratives and the rest of it. But it's not an easy one. I think it's now the way we procure things, certainly in the NHS, is not very easy to deal with. 70% of our suppliers are actually SMEs, but I don't know. That doesn't actually tell you a great deal. In terms of we're reaching. So I think it's an exciting but challenging area, procurement, and affordability. We're never going to compromise that much on that. But we are trying to move up to 10% of procurement being measured by social value. Yeah, and literally it was nothing a year ago. So I think that shows the gains of working on this agenda.
Yeah, I think just another example I'll throw in that's health related is Leeds Teaching Hospital are going to build 2 big new hospitals in the city over the next sort of 5 years or so. And partly through this work, they've become really motivated at how do we build in a lot of anchors best practice into that development. So a lot of that will be putting stipulations in contracts for things like for every £1 million spent, you employ at least one new entrant trainee who's been unemployed or moving straight out of education. So there's quite a lot where you can just stipulate in the service that's delivered, and it's still in a competitive framework. So there'll be some things that emerge, I think, and certainly there's examples of organisations who are making it work even with a tight cost environment.
Absolutely. Nicky, did you want to add anything on to that?
No, I think they've covered all of that way better than I could have.
It's a really good question, and I think that I've definitely heard it from a lot of finance and procurement leads, which is what does this cost? And just a couple of reflections again from the kind of North American context where a lot of my research has come from. Quite a few people said something similar to you, Andrew, which is it doesn't cost you anything to ask your suppliers to give you more, particularly on the value side of things. So on quality and value, you can set higher expectations, and it doesn't have to cost you more, but you do need to bake those in. And I think there are examples all across our organisations here and NHS and other anchors who aren't on the call of multi-million-pound contracts getting released every single day with very little additional expectation put onto them, and just changing some of those to set some higher expectations around social value or sustainability could deliver a huge amount. And I think this isn't universally true, but I did hear the chief operating officer at the Cleveland clinics talking about the fact that it's not necessarily new money, it's the refocusing of existing money. So it's kind of looking at your existing pot of resource and thinking about how it can deliver more for you. And with a few exceptions where I think sometimes things might cost a little bit more, like the examples that Andrew was sharing around living wage. Actually, I think there's a lot in that, which is thinking about how you refocus and become more intentional about the existing resource that you have. We've got just a few minutes left for Q&A, and there's 2 left. One for you, Andrew, from Simon. So for BARTS, how did you communicate internally across your organisations? And what was the role of AIs and social value? I don't know what AIs means. Is that just me? Social value experts.
I think that might be anchor institutions.
Okay, brilliant.
Well, what we did, we about a year ago, in fact, we brought together a lot of service leads across for a workshop, and we had our Health Foundation colleagues help us with that as well, and people from our hospital charity were involved as well, because we tried to involve them in terms of some of that. So that's the way forward. And I think then what we did is we went around, because we got 5 different hospitals, we went around, talked to the chief executives of all those hospitals, Obviously, we got a bit distracted over the last year, and really started to get them thinking. So what our thinking was that we would come up with a hospital group framework, and then we would add to that at local level. And as I say, at Whipps Cross, obviously, there's massive opportunity. It's a whole new hospital there with actually freeing up a lot of land for housing and community facilities and things. So you can imagine, so that's like a supercharged anchor network there. So I think that was and there was a lot of interest in this. People do get it, and so we've got some very good leadership who are saying, a lot of the good work that's been partnerships been particularly sort of developed over the last year is a good chance to really get a moral force from that really and move forward.
Brilliant. Thank you, Andrew. I'm going to come to all of you in a moment and ask you each to share some of your kind of tips, I guess, for others who might be thinking about developing a framework or an anchor strategy within their organization or across a network or collaborative of anchors. Because I know there are many people both on the webinar today, but also possibly watching this afterwards, who are in the process of developing their own missions and frameworks locally. And I know that you'll have learned a lot along the way about what worked well and what you might not do again. So I'd love to invite each of you to come in on that. And there's also a final question from Noel in Camden, reflecting on the difference between doing kind of deep work on issues with anchor organizations versus slightly broader target setting with each anchor, and a kind of question around scale. So how do you learn how to scale some of the, I think targets is what the question is about, across a broader range of anchors. So you might want to pick up on that as well if you have any thoughts on it. Les, can I come to you first?
Okay, so if I had sort of maybe one sort of tip learned to finish on, I'd say there's a real challenge in this, in getting something that's both strategic and high level, that will motivate leaders and cities and organizations to move forward. And that needs to focus on quite a few points and a few priorities. So for us, it's the 5 dimensions of the framework Nicky and I developed, which has become a bit of a framework for the network at that level, and a few priorities overall across those, but then having something really detailed that the practitioners can use and make the change with below it. So if they just looked at the 5 themes, it's well, so what? If you break it down to the 42 questions we've got on the levels 1 to 4 for each, and if you're a procurement officer, you've just got 11 things to look at and some helpful tips for things to think about and where you might want to go. So I think making sure you look about, you get the strategic high level commitment to drive it forward, coupled with something practical that practitioners can use in certain areas, has been really important for us.
Great. Nicky?
Yeah, I'd say one of the things about the framework is using it as a tool to really help organisations to understand what they're already doing, because so many of the anchors we're working with are already doing the best they can for their employees. They're all well-intentioned organisations, and they'll already be doing lots of things, but it's often quite highlighted, quite hidden in big organisations. And the framework really is an opportunity to sort of draw some of that stuff out and to accelerate it, to refine it, to put a spotlight on it, to kind of really grow things and help them to have more impact. And I think that kind of answers part of the scale question that was on the Q&A. I think the deep work is really, really important, because you've got to find the success, because that a lot of the anchor thing really is a sell. You've got to prove why it matters and the difference it can make, because there will be lots of champions, but there'll be critics and people that say, don't give me more work to do. So that those sorts of elements of the framework are really helpful in terms of helping people to realize that they're doing good jobs and that they can go further with the small amounts of refinement.
Brilliant, thank you. And last couple of reflections from you, Andrew.
I always think about anchors, it's like the 2 P's. It's practice and not that one. Practice and place. And in terms of place, we all live somewhere, and community, place about communities. But I think it's quite important to ground this in that. And the trouble with anything abstract, there's nothing more deadly than an NHS report, is there? So I think always keep reference to the place. These are your communities, people you serve, people who come through the door, and people you want to keep healthy. In terms of practice, I think good examples, and the reason I went on a little bit about the health work with schools and things in my one is I think it starts to live for people. once you see pictures of
Yeah.
diverse young people benefiting, that's what we do it for, isn't it? That's the result. I suppose the second tip really, and I've kind of alluded to it really, is that you do, though this is ultimately, I think, a bit of a social movement, we want everyone to be involved with it, you getting some good leadership. Clinicians are, doctors for good or ill are incredibly trusted people. So getting your, if you're working in the NHS, getting your director of public health, your well, there was a doctor, but you know what I mean, and your medical director if you're in a hospital, the chief executive, things like that, get them sold on it and then selling it to them makes a big difference. And unfortunately, we still work in largely hierarchical bodies, so we do need that kind of permission to speak to be given right from the top, as it were. And then I think it's about encouraging as much involvement as you can, really.
Brilliant. Thank you, Andrew. Thank you, Nikki. Thank you, Les. It was really, really wonderful to hear from you. I really appreciate your insights and tips. Once again, thanks to our panelists. It was really, really wonderful hearing about the work that you've been doing. And thank you all for coming today and sharing an hour of your lunch break with us. I hope that was interesting, and I hope you enjoyed some of the examples that were shared. Thanks, everyone.